Attention Deficit Hyperactivity Disorder, ADHD, is a mental disorder that affects children and adults. The symptoms of ADHD can include hyperactivity, impulsiveness, and inattention. There is no known cure for ADHD, but there are treatments that can help manage the symptoms. Adults with ADHD can benefit from therapy, medication, and lifestyle changes. But how to manage ADHD symptoms as an adult? It can be difficult to manage ADHD symptoms as an adult. There are many strategies that can help, including medication, therapy, and self-care. It is important to find a treatment plan that works for you and to stick with it. If you find that your symptoms are impacting your daily life, it is important to seek help. There are many resources available to help you manage your ADHD. How to manage ADHD symptoms as an adult? Attention Deficit Hyperactivity Disorder, ADHD, is a mental disorder that is characterized by problems with focus, hyperactivity, and impulsiveness. The disorder typically develops in childhood but can persist into adulthood. For many people, ADHD can be a difficult condition to manage. However, there are various strategies that can be used to help control ADHD symptoms. Exercise is one of the best ways to manage ADHD symptoms. It can be used as an effective treatment for people with ADHD and can also provide relief for those with other mental illnesses such as anxiety or depression, which often co-occur in children and adults with this disorder. Exercise improves attention due to its ability to increase blood flow to the brain. What should be done to manage ADHD symptoms in adulthood? ADHD is a disorder that affects people of all ages, but it is most commonly diagnosed in children. For many people, ADHD symptoms lessen as they get older. However, for some adults, ADHD symptoms can be persistent and interfere with daily life. There are a number of strategies that can be used to manage ADHD symptoms in adults. Some of these strategies include taking medication prescribed by a doctor, participating in therapy or counseling, using relaxation techniques such as meditation and yoga, which have been shown to improve moods and reduce stress levels. In addition to reducing the frequency and severity of ADHD-related problems, relaxation techniques also help people cope with everyday stresses more effectively. For example, if you feel stressed about your job, practicing deep breathing exercises may allow you to relax without feeling anxious or guilty about taking time off from work. What are the signs of adult ADHD? Attention Deficit Hyperactivity Disorder, ADHD, is a mental disorder that affects how a person behaves, thinks, and feels. It is more common in children but can also occur in adults. There are three main types of ADHD: inattentive type, hyperactive impulsive type, and combined type. Symptoms include difficulty paying attention, being easily distracted, impulsiveness, restlessness, and problems with organization and time management. The causes aren't known but may be related to genetics or environmental factors. Treatment includes medication and behavioral therapy. A combination of both is often most effective. If the child has a learning disability such as dyslexia, an additional approach called cognitive behavior therapy can help improve reading skills. What are the symptoms of adult ADHD? Attention Deficit Hyperactivity Disorder, ADHD, is one of the most common mental disorders diagnosed in children, but it also affects adults. ADHD symptoms can include difficulty paying attention, hyperactivity, and impulsiveness. Adults with ADHD may find it difficult to manage time and tasks, stay organized, and control their emotions. They also have a hard time managing money. As adults age, they often lose the ability to focus on things that are not immediately in front of them. This is because as we get older our brains don't work quite like they used to. In addition, many people who were diagnosed with ADHD when younger become less able to concentrate or pay attention later in life due to other health issues such as diabetes, heart problems, arthritis, cancer, depression, anxiety disorders, stress, substance abuse. What is the role of medications in ADHD management? Inattention, hyperactivity, and impulsivity are the hallmarks of attention deficit hyperactivity disorder, ADHD. Up to 11% of children in the United States are diagnosed with ADHD, making it one of the most common psychiatric disorders in children. While the majority of children with ADHD will outgrow the disorder, some will carry its symptoms into adulthood. For adults with ADHD, medications may be an important part of their treatment plan. But for children and teens who have been diagnosed with the condition, medication can also help them learn to control impulsivity, focus on schoolwork and avoid making bad decisions that could lead to trouble later in life. What is the role of behavior management in ADHD management? Attention Deficit Hyperactivity Disorder, ADHD, is a condition that affects children and adults. It is characterized by difficulty paying attention, hyperactivity, and impulsiveness. There is no known cure for ADHD, but there are treatments that can help manage the symptoms. One of the most important treatments for ADHD is behavior management. Behavior management involves teaching people with ADHD how to control their behavior so they can better be functioning in everyday life. This includes learning strategies that help them manage behaviors such as impulsivity, hyperactivity, and mood swings. It also helps teach these individuals coping skills to deal with difficult situations or feelings when they are unable to cope effectively on their own. This may include ways to calm themselves down if they become agitated by a situation. What is the role of diet and exercise in ADHD management? ADHD is a neurological disorder that affects how a person processes information, focuses and controls impulses. A person with ADHD may have difficulty completing tasks, be easily distracted, and have trouble sitting still. Diet and exercise are two important factors that can help manage ADHD symptoms. Adequate nutrition is important for brain health. Eating a balanced diet with plenty of fruits and vegetables can help improve focus and attention. Try to eat foods high in fiber, such as whole grains, beans, nuts, seeds, and legumes. Foods rich in omega-3 fatty acids like fish or flaxseed oil may also be helpful. Avoid refined sugar and processed food products which have been linked to learning problems. What are the common types of ADHD medication? ADHD medication is a hot topic in the medical world, with new studies and drugs being developed all the time. Here we take a look at the different types of ADHD medication, and how to manage ADHD symptoms as an adult. There are three main types of ADHD medication: stimulants, non-stimulants, and atomoxetine. Stimulant medications include methylphenidate, amphetamine, dextroamphetamine, lisdexamphetamine dimesylate, and dexmethylphenidate. Non-stimulants include bupropion, norepinephrine reuptake inhibitors such as vortioxetine, tricyclic antidepressants like imipramine or dizipramine, tetracyclics such as doxepin, trazodone, mirtazapine, and nafazodone. Non-selective monoamine oxidase inhibitors may also be used to treat depression in some patients who are resistant to other treatments. What are the adverse effects of ADHD medication? Attention deficit hyperactivity disorder, ADHD, is a mental disorder that includes problems with focus, hyperactivity, and impulsiveness. The Centers for Disease Control and Prevention, CDC, estimates that about 6.4 million children aged 4 to 17 years have been diagnosed with ADHD in the United States. A common treatment for ADHD is medication. However, there are some adverse effects of ADHD medication that adults should be aware of. Some side effects may not occur until long after the initial prescription has been taken, and others can last much longer than expected. Side effects in adults with attention deficit hyperactivity disorder include dizziness, drowsiness or fatigue, dry mouth, headache, insomnia, nausea, sweating, stomach aches, trembling/shaking, vomiting, weight loss, and sexual dysfunction. Is it necessary to take long-term medication for ADHD? Attention deficit hyperactivity disorder, ADHD, is a condition that affects both children and adults. Symptoms can include difficulty paying attention, hyperactivity, and impulsiveness. While medication is often prescribed to help manage ADHD symptoms, there are other ways to manage the condition as well. Adults with ADHD can learn how to better manage their symptoms by making changes to their lifestyle and by using coping mechanisms. In addition, they may be able to find alternative treatments such as physical activity or counseling. What is the role of natural remedies in ADHD management? Attention deficit hyperactivity disorder, more commonly known as ADHD, is a mental disorder that affects children and adults. It is characterized by problems with focus, hyperactivity, and impulsiveness. While there is no cure for ADHD, there are treatments that can help manage the symptoms. One treatment option is using natural remedies. There are a number of natural remedies that have been shown to be effective in managing ADHD symptoms. These include the use of herbal supplements, nutritional therapy, and diet changes, as well as lifestyle modifications such as sleep hygiene, exercise programs, and stress management techniques. What are the supplements that can help in ADHD management? Attention deficit hyperactivity disorder, ADHD, is a mental disorder that is characterized by problems with focus, hyperactivity, and impulsiveness. While there is no cure for ADHD, there are a number of treatments that can help manage the symptoms. One approach that can be effective is to use supplements along with medication and therapy. Some of the most common supplements used to treat ADHD are omega-3 fatty acids, magnesium, zinc, and probiotics. Omega-3 is a type of polyunsaturated fat found in fish like salmon or mackerel that has been shown to be effective for treating attention problems in people with ADHD. Magnesium helps control blood pressure and may help reduce anxiety. It's also very important for normal brain function. Zinc can improve memory and concentration as well as regulate sleep patterns. Probiotic bacteria such as Lactobacillus acidophilus have been shown to aid digestion and boost immune system health. What should be done for people who do not respond to medication? In the United States, it is estimated that 11% of children 4 to 17 years of age have been diagnosed with ADHD as of 2011. For many of these children, medication is an effective way to manage their symptoms. However, what should be done for people who do not respond to medication? This is a question that has yet to be answered. Some people may choose to try different medications, while others may decide to try non-medication treatments such as therapy or dietary changes. The decision of whether to take medication versus other treatment options for ADHD will depend on the individual and their family's needs. It is important that you discuss your concerns with a doctor who has experience treating children, teens, or adults diagnosed with ADHD. You may be able to benefit from additional support services such as counseling, parenting skills classes, nutrition education, and/or exercise programs. Is it possible to improve cognitive function without taking medication? Attention deficit hyperactivity disorder, ADHD, is one of the most common mental disorders diagnosed in children, according to the Centers for Disease Control and Prevention. While it is commonly diagnosed in childhood, many adults live with the symptoms of ADHD as well. ADHD can lead to difficulty focusing, staying organized, and controlling impulses. There are a variety of treatments available for ADHD, including medication, therapy, and lifestyle changes. However, the most effective treatment is usually determined by your doctor based on your specific symptoms, age, and other health conditions you may have. In conclusion, there are many ways to manage ADHD symptoms as an adult. Some people may need medication to help them focus and stay on task, while others may find that changing their diet or using specific supplements helps them better manage their symptoms. Additionally, there are many different types of therapy that can be useful for adults with ADHD, such as cognitive behavioral therapy or mindfulness meditation. By trying different methods and finding what works best for them, adults with ADHD can learn to live a happy and productive life.